Hi, Marilyn. Actually, I'll explain this. The IV saline. IV saline, it's amazing what a liter of saline does. I just woke up not too long ago. It's amazing what a liter of saline does. I talked about this in the ME advocacy video interview, right? I'm staying close because the room's messy here. I don't want to maybe see that. um, the blood volume issue. All right. Actually 90%. And actually, Dr. Bell said that there's a, when Dr. Bell did his study, and it's actually on National Seafood's website. Um, I know, hello, Birdie, my birdie wants me to uncover her. Anyway, uh, 90%, they say CFS and fibromyalgia diagnosis. I mean, you've probably seen my post. I always say those diagnoses are a sham. What are they? They're a name with a list of symptoms. And they make it sound like such a criteria. People think those are actual disease. And then they find out later on. I mean, how many people, later on find out they have some autoimmune or something going on. Anyway, let's get back to the autonomic nervous system and the IV. What happens is there's a blood volume issue, all right? And the thing with the blood volume, all right, that the study was the red cell mass plasma volume study, all right, and it showed lower blood volume. And actually, the better way to explain it, all right, and actually I've posted, videos of the orthostatic hypotension when you stand up, all right, the problem, same with the POTS. When the autonomic nervous system isn't working properly, it's not sending the proper signals, so your blood volume isn't circulating properly. All right, it's not circulating properly. It's sort of, you may have, the guy in London who is the head of the lupus clinic for years, Professor Graham Hughes, he talks about antiphospholipid syndrome, and they use the term sticky blood. All right, and that makes sense why there's a stroke risk with it. They don't tell patients. Stroke risk. When you stand up, like I showed in those posts a year or two ago, whenever I, tweeted those. Since the autonomic nervous system isn't working right, your blood volume gets pulled down with gravity. The gravitational force pulls your blood volume down. And it took me a long time to realize just what that ball and chain feeling was in my legs and that crash. And another way I explain it is, I like watching in any type of investigation. So I've been into plane crash investigations, right? And I saw a few, and I thought, oh, that's a really good layperson explanation to make it make the crash. I don't like that M word. It's very bad. To make the crash understandable. When the pilot's having trouble controlling the plane, there's something mechanically wrong going on with the plane, and they're trying to control the plane. And sometimes they either put the nose up or the nose down, and I forget which direction, but in one of those directions, they have to be careful because the fuel doesn't get into the fuel lines, and then the engine stall. Okay, the engine stall. All right, and when I saw that, I thought, oh, wow, look at that. Look at that. That's just like the ME patient, the patient with dysautonomia. All right, when they stand up, they're not getting enough blood volume return to their right atrium and their heart or their brain. So you got the brain, they call it the brain fog. There's got to be a better word than the fog. I just don't like that word either. And the low filling pressure in that right atrium, which that guy in Boston does that study, the invasive CPET, and he shows that the crash is the preload failure. All right, so if the plane is wanting to stall, look at the maybe the plane is going to crash. The plane could crash. Well, look at the patients who crash. All of them. All of them. So the IV saline really is helpful to that. I'm not going to say it's going to cure you, but the IV saline, I mean, actually, I've known people that get the saline every day. I do it once a week. In the summer, I'll ask for more because I like to walk outside in the heat out there. It's dehydrating. Yeah, so IV saline. I know it's a shame. I think all patients, all the doctors should write a prescription for IV hydration for the patients. So I'm getting ready to make my coffee. So there's the IV saline. You know, it's really nothing fancy schmancy. Although I mentioned there in the tweet, Colleen uses the Ringer's lactate or the lactated Ringers. I forget exactly which one, which are great plasma expanders. When I was a nurse, I used that. If the patient's losing blood, that's but same thing with the blood volume. It's a better expander, so I'm sure, she's said she's got great results from it. So these things, these are just therapies that improve the patient's quality of life. I mean, we know the quality of life. It's terrible. I'll tell you, for years I thought there's no way you could be alive in, 5 more years being this ill. I mean, this went on. I kept thinking, and then when I got to, 25 years, I says, oh, there's got to be something that treats us because, to still be alive and linger like that. Anyway, so there's my talk on the IV saline. Have a good day. I know I tend to yap a lot.